Hello, I am Dr. Jungchul Park from Hyo Dental Clinic. Today, I would like to share a case with you about maxillary sinus augmentation with implant placement simultaneously. First, if you look at the patient's initial photos, although the left side of the maxilla isn't in good condition either, the patient mainly came in complaining of mobility of number 14. Also, teeth from the second premolar to the second molar are missing. So I plan to treat with implant procedure. In the photo, you can find significant bone defect around number 14 and significant bone resorption as well. I will also place an implant in number 16, thus 2 implants for number 14 and number 16 in the form of a bridge. You might wonder which option is better, placing 2 implants or 3 for number 4, number 5, and number 6. I decided not to do anything about number 7, because then number 7 tooth on the mandible was erupted like this. So it's very difficult to treat number 17 with an implant because of this erupted tooth. In addition, the tooth has poor periodontal condition, and procedures like occlusal reduction or intrusion would not be easy. The patient's financial situation was also a major consideration. Therefore, my primary treatment plan was not to restore number 7 and to only restore up to number 6. Placing 3 implants for number 14, number 15, and number 16 would have been ideal. This is because the sinus pneumatization was quite extensive and the residual bone was thin. Defect in number 14 was large. For a case where the bone quality is not good and significant sinus augmentation and GBR are needed, placing 3 implants, 1 per missing tooth, would be biomechanically better. But we would always have to take into consideration a patient's financial situation. So after discussing with the patient, I plan to place 2 implants at number 14 and number 16. And for number 14, I decided to extract it and then place an implant immediately there. Even though there's still some defect at number 14 on the CT scan, it might still be possible to achieve primary stability using the sinus floor. I also plan to perform both sinus augmentation and implant placement at number 16 so that I can finish the surgery all at once. And for sinus, I decided to use lateral sinus augmentation. Here's the intraoral view. There wasn't any severe soft tissue recession at number 14. So I proceeded with the extraction of number 14. Keratinized tissue around number 16 was also sufficient, so I decided to go as planned. This is an intraoral view after extraction of number 14. For number 16, I first opened a lateral window for sinus augmentation. You can see the process in the surgical video. I also placed implants at both number 14 and number 16. There was a defect on the palatal side of the number 14 site. You can also check it in the surgical video. For bone grafting in the sinus, I mainly used allograft material. Why did I use allograft? In the sinus area, I wanted the implant to be surrounded by newly regenerated bone, so I used allograft, which has regenerative potential. I have recently started to frequently use synthetic bone grafts too. These days, there are many types of synthetic bone that has the same properties of allograft, unlike the synthetic grafts we used in the past. However, especially in lateral sinus augmentation, it's still better to use a graft with regenerative property. So I used an allograft here. As for the buccal side, where I opened the window, when I used particles, I've often felt that repositioning the window later doesn't lead to a perfect fit. But if you block the window with a collagen material, like AOS collagen, and then put the window in place afterwards, the window is covered well. Because of the good fit, I am now using it in that way for many cases. So, this is a case where I did the implant placement and sinus augmentation simultaneously. If you look at the sinus augmentation on the buccal side, I grafted allogenic bone inside the sinus and then applied the AOS collagen on the window side. And after the bony window, the bone was repositioned to the original site. The implant stability wasn't severely decreased, but I managed to ensure primary stability while there wasn't much residual bone at both the 14 or number 16 sites. So in this situation, using a big healing abutment may cause some trauma to the patient during chewing because the upper left teeth are also in poor condition. That is why I intentionally placed a small diameter healing abutment. The head of this healing abutment is about 2 millimeters thick, so I intentionally used this small one and finished the surgery. This is the post-operative view after suturing. Now, let's go through the surgical video to review the procedure step by step.
연결해놨어. 네.
크게 한 번만 해주세요. 임플란트 이제 씹는 거예요.
그대로 입 벌리고 보실게요. 이게 잡죠. 아니요. 여기 구멍 상태로 그냥 가시면은 보이는 거예요. 이분 각대로. 근데 이게 묶으면 안 돼가지고 제가 지금 그냥 이거 실래요?
수술을 마친 후에
This is the panoramic and CT image after surgery. You can find the allogenic bone grafted into the sinus. There was no membrane perforation. At the number 14 site, I placed a TSIV implant to obtain better primary stability. This image was taken about 6 months later, after all final treatment was completed. If you take a look at the sinus window, you can find that the regenerative bone graft material facilitates the formation of new bone. Although volume change occurred to some extent, you can see some of new bone formation throughout the sinus. Whether it be a lateral or crestal approach, the most important factor is that the graft material should be in a wider contact with the bone and the sinus membrane. Grafting over the wide area like this is important. Instead of narrowly grafting the number 6 site only, covering a wider area allows for more favorable bone regeneration in the targeted area. Postoperative images also show well-regenerated bone and stable results.
유리한 것 같고요. 치료 후의 모습 보면은 이제 재생이 잘 되어서 이렇게 잘 유지될 거라고 이렇게 생각이 되고요. CT 사진 보면
Here's the CT of number 14.
14번의 CT 사진인데요. 이렇게 디펙트는
As there was some defect, I aimed to gain stability here, and because tapered implants provide better stability, I used a TS4 implant. Post-operative images show that new bone is formed well in the defect area. At number 16, while there was some sinus membrane thickening, I confirmed that the ostium was open. Implants were placed and membrane perforation was not found in this case. You can see that new bone formed well around the implant. I hope today's case presentation will be helpful for your clinical practice. That is all for today. Thank you very much.